exchange webinar, which will this morning focus on digital health, well-being and smart specialisation. I'm going to hand over to my colleague, Kenneth Johannesson, in one moment, but we will just quickly move on to the next slide and introduce the agenda to you all. So this morning, after a brief welcome and introductions, we will go on to setting the scene around the smart specialisation agenda in region Värmland in Sweden and in Scotland. And really the objective of this webinar this morning is to share our experiences from both of these two AER regions on how we are supporting the development of digital solutions to support healthy living and well-being, and how both regions have gone about fostering collaboration between the public sector, universities, civil organisations and businesses. We'll touch on how we intend to achieve business growth and efficiency, particularly in public health services, and we'll also look at how digital health innovation fits with our region's smart specialisation strategies. So I'm going to hand over to Kenneth and then I'll come back and we'll begin the session. Kenneth?
Yes, hello to you everybody. I hope you are well. My name is Kenneth Johannesson and I am a healthcare politician in Värmland in Sweden. Within the Assembly of European Regions, I have the assignments as Vice President of Health Innovation within the Committee of Social Policy and Public Health. In order to be able to offer proactive, more personal and cost-effective care, we constantly need to find new forms of innovation. Digital health means a digitalization of services, where the goal is to prevent and manage diseases more effectively. Digitization also provides flexible healthcare. The new possibilities that digitalization offers can be applied to a variety of uses. Everything from electronic medical records, virtual visits, and patient portals to early disease detection and diagnosis, self-management of chronic conditions, and psychological support. Digital health increases the focus on the patient's well-being. For care providers, this means safe and faster decision-making, which in turn increases patients' confidence. The availability of relevant patient information and direct contact with a specialist when needed contributes to increase patient safety. In addition, access to laboratory test results and personal health information is an important part of the patient's commitment and decision-making. Good digital health within the organization thus gives the patients a promise of accessibility and security, two basic factors for a competitive offer in healthcare. I know, for example, that the vision for digitalization of welfare services in Värmland in its strategy for smart specialization reads as follows: a welfare sector for co-creating citizens with a well-developed and safe IT environment as a base, where the focus is on the human aspect and the individual's benefit from new value-creating processes. That is why I am proud of the program for today's webinar, where we get Värmland and Scottish experiences on how important actors can work together to bring about a good development of digital health.
Thank you very much, Kenneth. And I should have introduced myself at the start, I'm Donna Henderson. I'm chair of the AER Digital Health Network, and my day job is Head of International Engagement with the Digital Health and Care Directorate in Scottish Government. I'm going to very quickly introduce our panellists for this morning. So setting the scene on the smart specialisation environment in Scotland, we have Anders Olsson, who is Manager of Research and Innovation in Värmland Department of Regional Growth. Anders will introduce himself, I'm sure, during his own presentation. We have Linda Murray, who is Head of Strategy with Scottish Enterprise. Welcome, Linda. And then we have Magnus Bårdén, who's Managing Director of DigitalWell Arena and CEO of Compar. I hope I pronounced that properly. I'm sure you'll correct me, Magnus. And finally, Professor George Crooks, who is Chief Executive of Scotland's Digital Health and Care Innovation Centre. So welcome to our panellists. The agenda for this morning is for you to listen to some presentations from our panellists, and we will take questions. So what I would kindly ask you to do is please just note your questions as they occur to you in the chat, and we will keep an eye on those and we'll pick them up during the session. We do have a wrap-up part at the end of the session where we will have more open discussion, but please do just note down your questions as they occur to you. I'd also just like, before we start, just to remind you that we are actually recording this session, so you will be able to get a recording of it at the end, but just to make you aware of that. Okay, well, welcome everybody, and I should also say that in terms of the participants this morning, we have approximately 70 people registered from literally around the globe, so welcome to you all. And we're very, very happy to be sharing our experiences, and we would very much welcome your inputs and thoughts to what you hear today. So I'm going to hand over now to Anders, who is going to just share his screen. So welcome everyone. Our panelists, you can switch your videos off now. Thank you.
So thank you, Donna. Can you see my screen now?
We can, Anders. Yep, you just need to, that's it. Perfect. Thank you.
Yes, and I will say some words about digitalization of welfare services, which is a part of the Värmland Smart Specialization strategy, as mentioned earlier. I'm the manager of Smart Specialization in our organization, Region Värmland, and we are responsible for this strategy in this region. See if I can change slides now. Yeah. First, some words about Värmland. It's 18,000 square kilometers in area, slightly smaller than the land area of Israel. We are covered by 70% of forest, and we are 280,000 Värmlanders. The gross regional product is nowadays slightly under the average of European regions, but we are a strong innovator according to the European Union Regional Innovation Scoreboard. Our strongest businesses are within the forest industry, and we have an ICT clusters with I think even more than 2,500 employees nowadays. We have one university, that's Karlstad University. We don't have any science park, but we have an innovation park where Magnus Bårdén is at the place at the moment. The largest lake in the European Union is in the southern part of our region. And we are situated on an axis from St. Petersburg, Helsinki, Stockholm, our capital city, Oslo, Karlstad, Oslo, and Glasgow. We also include in that axis these days. And also some words about the healthcare system in Sweden. I think it's important to mention in this context. We are 21 regions responsible for healthcare in Sweden, and it's quite decentralized systems. But it's also regulated by central laws, and the central government also established principles and guidelines and to set the political agenda for the health and medical care sector. So we 280,000 inhabitants in Värmland. We have about 7,000 employees in the healthcare at our organization, Region Värmland. And we also 40 employees working with the regional development on a daily basis at Region Värmland at the same time. This is the front page of our Smart Specialization strategy. As you can see, we had to update it pretty soon. But in our interpretation of Smart Specialization, that is smart ways to organize and develop existing regional assets in order to create value for users and society. And in that respect, our specializations are both about what we are good at and what we're good for. This is a model about how we created the strategy. It should be based on a strong business sector. That's the foundation. But we also need the assets to develop new knowledge, and that's the researchers. And it needs to be a demand for the products, the innovations, and that's the market aspect. And today we are talking about one of 5 specialization. It's about digitalization of welfare services. And some words about how we went from having identified the strong business areas in Värmland to formulate them as smart specializations. From pulp and paper and packaging, we went into formulating that as the forest-based bioeconomy. The IT and telecom sector was merged with the healthcare sector within this specialization, digitalization of welfare services. And the steel and manufacturing industry, there we formulated the specialization as advanced manufacturing and complex systems, etc. This is a very brief story about the development of the digitalization of welfare services. It started off, as in many cases, with the crisis when the Ericsson company decided to shut down their operation in Karlstad. They used to make the software systems for the mobile phone systems. And after that the downturn, we worked with, and especially the cluster Compare, which Magnus represents today. They worked with the mission that we will be competitive in testing complex IT systems that are critical to businesses and society. And that was a competence that stemmed out from the Ericsson company because the cost for developing such a complex IT systems, which mobile phone system is, the costs are mainly about testing that it works. And the Compare cluster, they worked with this mission, this vision, and at some point they met the manager for the regional healthcare organization. And they realized together that the healthcare IT systems are quite complex and quite critical for society and the patient security. So they formed the organization Nordic MedTest, which today has developed into being the national organization for testing the healthcare sector's IT systems in Sweden. So when that mission was accomplished, the new one was not only test, but also develop. And then we and Compare worked on this mission for a number of years. And last year, the 1st of January, we were, together with Compare, the winners in a national contest from the National Innovation Authority, Vinnova, where the winners, they got 10 years of funding for developing a globally competitive innovation system. So that was really a milestone for us in our region. So coming back to this model, on the market side, we also put the societal challenges and the United Nations Sustainable Development Goals, because they are also indicators that it is a long-term need for the solutions that we can provide within the smart specializations. And as was mentioned in the introduction here, this is the current vision for this specialization, a well-developed and safe IT environment where the focus is on the human aspect and the individuals benefit from new value-creating processes. And we do this by testing services with real users, patients, doctors, etc., and design new and better solutions. But I think now we are ready to update this version in the next version of the smart specialization strategy. I think Magnus will mention something about the ideas that we are currently working with. One cornerstone in our smart specialization is the university in Värmland, Karlstad University. There we have a cooperation agreement with them, Region Värmland and Karlstad University, which has the name the Academy for Smart Specialization. And the Academy should be a tool for transformation and renewal of the private and public sectors in Värmland, and the strengthening of research and education at Karlstad University. So that's the aim for this cooperation. And for instance, Marek Persier from DigiRadio at the European Union, he said at one point that the Academy for Smart Specialization is the best practice in Europe on how you can connect universities to smart specialization. Within the area of digitalization of welfare services, we have, for instance, collaboration between 4 different research groups. It's the gender science group, the nursing group, the service science, and the computer science groups. And for instance, within the computer science, they connect to the field of health by working with security, cybersecurity, and personal integrity, ensuring the quality of mobile health applications, AI, and also 5G solutions within this area. Recently, the OECD have also evaluated the Academy for Smart Specialization, and last week, it's a screenshot from the OECD lead committee. At that meeting last week, they approved this report. So this will now be an official OECD report, and with a global distribution. And we're also discussing a high-level meeting following and spreading the knowledge of this report as well within the European Union and all over other places in the world. So we have recently also monitored what has happened within this specialization. And I think we can claim now that the innovation system is now well organized within this area, and there are good reasons for high expectations on results and effects with respect to innovations, growth, effects on healthcare system, and last but not least, on individual health. Yes, thank you. That's the final words from me right now. So I will stop sharing my screen. Hope that works.
Thank you very much, Anders. And thank you very much for sticking to time. I'm just checking the chat. If anybody has any questions for Anders, please do put them into the chat. That would be very helpful. Thank you. Anders, I just have one very brief question myself, actually. Just in terms of the Academy for Smart Specialization, how was that funded? You know, what was the, you know, what's the funding model behind that? That's very, very interesting approach.
Yeah, it's based on an agreement, and where we and our politicians have set aside 5 million euro for this 5-6 year period for co-funding projects at Karlstad University. And Karlstad University, they co-fund with even more, and we have also said that they also have to apply for external funding with at least also 5 million euro. And we can now see that the total value for these project portfolios has even more higher values. And if we add on the projects that the researchers themselves apply for and get funding for, I think we will reach over 50 million euro for the program as a whole. So it also has a dynamic effect that we can add on even more funding for this kind of research.
Excellent. That's really interesting. Thank you very much. We've had just a request in the chat for a link to the OECD report, so we will add that in shortly. Thank you very much, Anders.
But
Okay.
I comment it is approved now, but it's not distributed yet, the report, but we can come back to that.
Okay, so we can make that available on the AER Digital Health Network site and make sure we circulate it to participants. Thank you very much, Anders, for your time. Okay, so we're now moving on to Linda Murray from Scotland, who will introduce herself and set the scene for smart specialisation in Scotland. Thanks very much, Linda.
Thank you, Donna. Good morning, everybody. So I'm Linda Murray. I am Director of Strategy at Scottish Enterprise, and I've been working in a strategy role for a little over 5 years now in Scottish Enterprise. So that means I'm much more of a generalist than I am a specialist in some of these subjects. So I'm not going to focus on the particular health-focused work in Scotland, because George, who comes later on in the agenda will do that. I'm going to focus on some of the kind of big picture scene-setting pieces here. And one of the things that I guess will run through all that I'm going to say is about the importance of collaboration. And one of the kind of main things I've learned over the last few years is that, well, as an organisation, we can do some things really well ourselves. There is so much more value that comes from working in partnership with other enterprise or skills bodies, or the wider public sector and the private sector in Scotland. So that will definitely be a theme as I speak this morning. I've assumed that many people won't know what Scottish Enterprise does. We are Scotland's main economic development agency. Our key aim is to help build a resilient and thriving economy in Scotland. And in recent months, we have very much focused on how we deliver a green and inclusive recovery once we come out the other side of the pandemic. We work very much with partners to develop new innovative solutions to global challenges and opportunities that continue to put Scotland on the map. And we are always really keen to look at where Scottish innovation and knowledge and expertise can help contribute to challenges that are impacting on people, not just in Scotland, but across the world, and to see where we can foster some really interesting and innovative partnership approaches. Now, in the last few years, one of the other things I've done in my job is I've led the enterprise and skills response to EU exit in Scotland, and more recently the COVID partners response in there. This is very much about collaboration and about bringing together public sector, government and private sector organisations, and understanding where each of us have strengths and how we can work to our strengths, but also that power of working collaboratively together. At the same time as doing that, I've worked to support Scottish enterprise and Scotland's international engagement, including work with Scotland Europa as part of Scotland House Brussels. And this year I've already been involved in a number of different events and made contributions to the recovery work webinars that have happened already with European partners such as ERIN and the Vanguard Initiative. Nessa, if you could move on to the next slide, please. So, I think we skipped a slide there. There should be a slide with some bubbles on. If we don't have that, that's okay. So Scotland has a broad, that's it, thank you Nessa. Scotland has a broad innovation ecosystem that brings together that wide range of partners I've talked about. So government, enterprise agencies, universities, research institutes, innovation centres and a whole load more, as well as some more local research and innovation systems such as those on many of our islands. We like to think when we're talking about innovation and smart specialisation that we were very useful as a critical friend to the Commission in the early days of the S3 work. We had lots of questions as we were doing quite a lot of this already, and through that exchange and discussion we learned that we actually also had a lot to learn as well from other people. I think this kind of joined up approach is very reflective of how Scotland approaches economic development more broadly, with a lot of cross-agency collaboration, and that plays an increasingly central role in how Scotland's innovation ecosystems function. I think really key in that space, though, it's not all about in Scotland. We are absolutely an outward-looking country, and it's really important that we work with EU partners in that, and we have learned so much actually from the work we've done with EU partners. We're also really interested in looking at a place-based innovation approach, how we apply innovation in a regional context, as well as thinking about industrial policy at a more national level. And I think one of the kind of the key things I would take from this is, so while we don't have a formalised smart specialisation strategy, what we do have is an agreed and prioritised approach based on the shared S3 principles, looking at areas such as green energy, tourism and life sciences, but creative industries, food and beverages and financial services as well. And I think one of the kind of the key things here for me is we've learned a lot in the last few years, and while we'll be looking at more change in the next few days as we formally leave the EU, we will be looking at how we can continue to work across Europe with those common values and the commitment to collaboration that we have here in Scotland. Nessa, if you could move on to the next slide, please, that would be great. So one of those collaborative initiatives that we've been heavily involved in is the Vanguard Initiative, and you can see from the slide here it involves many regions across Europe. We in Scotland have been really central to the founding of networks such as Vanguard Initiative and ERIN, and we've been a leading member in Vanguard since the beginning, and we were one of the early signatories to its founding declaration back in 2013. And an early board member and chair of the network too. And I think we are hoping to be elected back onto the board next week. I think I've got that right. But this kind of engagement has really allowed Scotland to strengthen cooperation with partners from a variety of different regions, and has led to numerous successes, as well as seeing that alignment of strategic ambition. If you could move on to the next slide, please. Thank you. So there are a number of pilots currently in that Vanguard Initiative, and we are involved in 3: ADMA energy, efficient and sustainable manufacturing, and bioeconomy. I'm not going to go into any detail on those because I'm really conscious of our time. So if we can move on again to the next slide, please. Thank you. So engagement in each pilot is really tightly aligned to where Scotland has some comparative advantage. So for example, with the ADMA pilot, it aligns with themes such as abundant natural resources, enterprise and supply chains, world-class innovation centres, an ambitious energy strategy, and a supportive environment. So that is a very quick run through of all that we do and what we've learned through smart specialisation work, and some examples of what we've done to develop the collaborative innovative approach with European partners. But it's 2020, and I'm sure for all of us it's been a year like no other, and everything's just a little bit more complicated and a little bit more challenging than we might have expected when we started out in this year, and that's before we even get into thinking about all of the negotiation that's happening at the moment between the EU and the UK. Nessa, if you can move on to the next slide, please, and that takes us into the kind of what next. So the strategic future priorities for Scotland, we have really developed our collaborative approach to economic development and innovation through work on S3 and through learning from international collaborative projects. By engaging in these types of networks, Scotland can continue to contribute its own learning and also learn from others that we know and trust. And I've seen so many examples of that actually just in the last few years, where there's a real high degree of commonality around important themes and initiatives in Scotland and across other regions of the European Union. And I think it'll be a real priority for us to continue to look at how we engage once things change for Scotland and the rest of the UK at the end of this year. Nessa, if you could move on to the next slide, please. So Scotland has contributed to the consultation on S3, as well as playing a role in the contributions of our core networks such as ERIN and the Vanguard Initiative. Scottish partners' contribution highlighted the need for a focus on green and digital transition and on health and well-being, including those aspects of health inequality and digitally enabled healthcare and integrated care systems. And we've seen, as we've worked our way through the impacts of the pandemic here in Scotland, that it's a really highly complex and integrated ecosystem that we're operating in here, where we cannot look at things like health and the economy as two completely different aspects of what we do. We have to look at the interconnectedness of those and understand how they impact on people and communities, not just in Scotland, but internationally. I think the other thing in our contribution to that consultation, we also noted the need for flexibility to respond to immediate priorities and complementarity with programmes such as Interreg and Horizon Europe. So I'm conscious of time. My final thoughts on all of this, I think we have much in common. I think we can go further and faster in responding to common challenges and opportunities through the collaborative approaches that we've been building in the last few years, and that I hope we will continue to build. Our universities and businesses need to collaborate internationally to compete internationally. It's all very well and good if we can collaborate at home here in Scotland, but if we can't take that onto a global stage, that really limits our capacity to deliver on our ambitions. And above all, when it comes to innovation, our relationships with partners such as yourselves and with our networks in Brussels and across Europe are really crucial. So whatever happens in the next few weeks on the future UK-EU relationship, on the kind of policies and rules that we're working within that are agreed in Brussels between EU member states, we will absolutely be looking to continue to influence the operating environment in Scotland. We'll be looking at how we can continue to have international partnerships and where we can learn from each other. I think for me, this is even more important now than it has ever been before. And I think we really do need to look at the future as part of that wider ecosystem. And Nessa, if you could move on to the final slide, please. Thank you. So I think in summing up, I would say we are genuinely a committed partner to European recovery, working more collaboratively with European partners and for health innovation. I think that will be a key focus for us all, and we have learned so much, as I said, in the last few months dealing with coronavirus. I've been delighted to be here today, so thank you very much for inviting me along and to share my thoughts on the work around a collaborative economic development with you. And I would like to say we do absolutely continue to focus on maintaining our international engagement and collaboration efforts in the years ahead. So we will absolutely be looking to keep in touch and continue our strong working relationships. Thank you very much.
That's great. Thank you very much for that, Linda. And yeah, I have to say that I would certainly echo everything that you've said there. We're very much here to stay, Scotland, and we're very much committed to ongoing collaboration with the very many partners that we can see actually from across Europe and beyond in the participation list today. Just picking up on a couple of questions. I think one is actually just going back to Anders' presentation, and you've answered that, Anders, thank you, but I'll just pick it up so that everyone is aware of it. So that was from Johanna from AER, just asking about vocational education and training sector, and are they also involved in the smart specialisation strategy in Värmland, which Anders has confirmed. Yes, it's actually a very important part. Aspect of S3, and that competence is a key aspect of smart specialisation, which I think, Linda, you would concur with.
absolutely. I would, and I think that the connection between enterprise and skills is critically important. And I think we're still working our way through that in Scotland, but we've seen some real benefits from the approaches we've taken in the last few years.
That's great. Thank you very much. And then there was just a comment from Kenneth. In Sweden, we're very impressed with GERFIC, getting it right for every child. And how digitalized is this model? It's an inspiring model in a smart specialization theme. So I think if you don't mind, Kenneth, we'll save that one for George later on. And we can certainly pass on more information about GERFIC, which we will explain later. So Linda, thank you very much for your presentation. We very much appreciate your input today. So moving on to the next part of the agenda. So this is, so we've heard from Anders and from Linda on setting the more general scene around smart specialisation in Värmland and in Scotland. And we're now going on to really get into the meat of this session, which is very much around digital health well-being and that link with smart specialisation. So how do we create these ecosystems for digital health and wellness in both regions? So first up is Magnus Bårdén from DigitalWell Arena, who will introduce himself. Thanks, Magnus.
Hello everybody, nice to meet you. I'm Magnus Bårdén. I'm the CEO of Compare. Compare is a digital cluster in Värmland, Sweden. And we are about 100 ICT companies working together with digital competence supply, digital business development, and digital innovation. And this is the area of digital innovation I'm going to talk to you about today. So, and there we've working with something we call DigitalWell Arena. It's a Vinvext initiative working. I will talk to that later on. As Anders said, we are both a digital cluster, Compare, but we also are a driver for the digitalization of welfare services, smart specialization in Värmland. So we have worked many years, as Anders said, to be there what we are today. But 2 years ago, we won a competition in Sweden, and we become a Vinvext initiative. Vinnova, as the Swedish innovation agency, they want us to develop an ecosystem, creating growth by user-driven innovation in digital health services. And we shall support health through cost-effective and accessible solutions based on the individual's needs. That's quite a big challenge and mission, I think, we got from Vinnova. The Vinvext initiative is built from regional strengths, as Anders said, and this is all the Vinvext initiatives in Sweden. So if you are maybe not familiar with Sweden, but in the city of Borås, they are very famous of producing textiles, and then they have a Vinvext initiative calling smart textiles and so on. So this is a lot of different regional initiatives, and this is our mission is really to, during 10 years, making some transformations. So we have 10 years financing, building innovation ecosystems. So that's quite good, and because it takes time. It takes time to get this public sector to get connected to innovative business companies and entrepreneurs and research, and really make this happen and change it. This is another way to put it, because we all want to find some way to go forward. Everyone must feel that we have a vision or something like what are we going to do in our ecosystem. So this is our manifest, and I read it to you because I think it says something about what we are working on. Together we can ensure well-being for all, because we can, we like, and we must. The knowledge of what awaits us makes us our responsibility to gather experts, visionaries, and fellow human beings to overcome the challenges facing health and welfare. We need to build new systems and test new services so more people can enjoy longer, better lives. Together, we develop the solutions we need to embrace the future. A health society that ensures more equal care, inclusiveness, and innovative strength, as well as security and well-being in everyday life. When we talk about this in the public sector, they say, yes, well, we're with you, we want to participate. When we are talking to the companies in Compare and other companies, say, yes, we want to be a part of this. And the researchers are also very interested to make a transformation. So communication is very important for us to really engage everyone to be part of it. So why did Vinnova finance this innovation ecosystem for 10 years? Yeah, Anders had said something about it, because we have during a long time built research competence in Värmland about service innovation and service design. So we have 70 researchers at Service Research Center in the university. We have a RISE is the Swedish innovation research center in Sweden, and we have also Experience Lab. It's a lab for service design in healthcare. So they're all in Karlstad. Then we have research in the computer science. We have cybersecurity, data communication and software development experts. We have research for nursing in Karlstad University. And we have Gender Research Center. These 4 research groups have never collaborated before. So when we started this one, now they're working very close together. They're working with a common project called DigitalWell Research Group in the university. They are now searching for finance and funding for new projects, searching for new competence and knowledge. So I think it's happened a lot when you come together from a certain mission you want to reach. And then if you add 100 ICT companies, very much in need of a transformation from a consultant perspective to a product and service perspective. So a lot of knowledge, but we have to transform that into new companies, new services coming the public sector and the society to do better. Then we have built, as Anders said, the Nordic Med Test in Karlstad. We have very deep competence in test and validation. We also have it in our companies. It's all about the Ericsson period. We learned a lot about test in this region, and we have developed that since that. We have a strong regional leadership because we don't only have financing and funding from Vinnova. The region Värmland is funded as more than Vinnova, so we have a great number of Swedish crowns as a base platform for developing this ecosystem. Then we have the Academy for Smart Specialization, Anders has mentioned that. And then we have the healthcare employees. Very important in this area. Healthcare so we really involve them in the innovation processes. So innovation is not something we do beside the normal business. We started with this partners. So we are 17 partners today driving this ecosystem, this innovation environment. So if you wonder what I'm doing on a daily basis, this is what I do. I'm trying to link these organizations together, forming a vision and activities really to go from where we are today and what should we be tomorrow. So, as you know, if we're going to work with innovation in digital health, we have to build trust and innovation capacity. Without trust, it's not possible really to work together. So during the first 2 years we have been in action in this DigitalWell arena, we have working with building innovation capacity and trust. We have 5 areas. So we have building this innovation capacity. Open innovation. We have tested, we have 7 innovation cases from a challenge or a problem in public sector. We have involved researchers and businesses to solve them and make and create new innovation together in a process, service design process. So that's what we have tested to do, learned a lot. We have built test arenas and test services because we are working together with Nordic MedTest really to develop new test services, so it will be very safe and to test the new services in the real world. So we have a process for how to test new products so it will not go wrong, so to speak. We have built co-creation spaces. We have a DigitalWell innovation hub in Innovation Park here. We have a digital collaboration platform because we have to have a special platform really to work together. All the experiences, we are collecting them in a toolbox for innovation so everyone can really get the experience and we can spread the experience in that. And we're also building a data infrastructure because we have to have health data for innovation. So that's what we're working on very much at the moment. The other area is commercialization and scaling, because we have to work with innovative companies and entrepreneurs. So we have built something like we call an innovation support, and we're also building an accelerator. I will come back to that. Then we have a working area, it's the research working area. It's the DigitalWell research group working together. We have also developed educations, so we have to, so the researcher can be a part of really get out with knowledge to public sector and the companies. And we also are in the area of how to attract competence, really working with this area. When it comes to innovation, we must have something, it's a lot of barriers really not to working with innovation in the public sector, I think. So to manage that, we have to really work with the management in the public sector with innovation management. And innovation must be a part of the agenda. And you must work with trust in your own organization, really to try to have the courage to open up your environments. But even if you do that, it's not you're not sure that you really can work with innovation because there are a lot of policies, culture, values, and so on as barriers, really. And it's involved a lot of actors because it's not, you are not only depending on your own organization, you are depending on other organizations, authorities, and so on. And that's why we are working with policy questions as well, because we have to, on a micro, meso, and macro level, really want to try to find solutions where we can avoid this or erase these barriers really to get forward with innovation. And then we have a working area where we really want our 150 million Swedish crowns to be at least 4 times bigger, so we really can make great innovation investments in this region. So this is how we're building innovation capacity in the region, and that we have done for 2 years, preparing for doing things in reality on a real way. So we are working with something we call Health Arena Värmland. Because now we have to go from making different certain innovation cases. We are testing, some companies are testing in some places in the organization or in the healthcare and in the municipalities. Now we have to focus to do it in a more proper way, focused on some areas. We call it Health Arena Värmland. Because it's a problem, I think. It's not that we don't focus on innovation in Sweden, but we do it all over the place and in small pieces. And it will never be really a transformation. So what we want to do and are doing is to build health arenas around a small municipality, about 10,000 inhabitants, and making that area as a test area. We're also building smaller ones as schools, as elderly care functions and so on. I will come back to that. But we have to test before we invest. And we have to try to focus on it. I know that Region Värmland it's about 100 innovation or development projects running at the moment, that they are all over the place. Imagine if we could focus them on certain areas. We focus really the entrepreneurs and companies focus on certain areas. And we focus researchers' work in certain areas. Then maybe something different can happen. And we can test before we invest in the total picture. So we have, in these areas, we are creating the Health Arena Värmland. We must think different. We must think from an organization, from the individual perspective. Today, we see a transformation. From today, the inhabitant, me as a person in the healthcare system, are very passive in Sweden. We want to make it more possible to be more active. I am a resource for health. I want to contribute. Today, we think an organization shall solve everything for us. What we are doing is really to get Region Värmland and the municipalities in Värmland to be the basic, the big gear wheels. And then we add research, authorities, innovative companies, international actors, non-profit sector, so to speak, and really to make it possible to reach a higher gear forward. So what we're going to do in this health arenas? Yeah, we want to test health services, developed from a user perspective and challenges in public sector, because the public sector must be involved, and all the employees, or some of them at least, in these areas must be involved. We are now trying to have new ways of preventing and treatment for diabetes, suicide, and mental illness, so to speak. We tested new digital services from entrepreneurs all over Sweden. And we collect and use data for innovation and services, and we test behavioral changes in the society. So that's something positive, I think, if you focus on a special area. because then you can also try to change, because we are not lacking services really, but we are lacking in not using them, and we have not implemented them in a process involving the individual. So more, what are we doing now at the moment? Yeah, we are developing a health arena in Arvika, how we use IoT in school, creating health. We are now sitting together with the municipality in Karlstad. They want us to develop a test arena where we really can work with new digital solution, offer their customers in the elderly care independency and safety, a platform with innovative services. And they want us to involve innovative companies in all Sweden. And they don't want to own the solutions. They only want to support us to do this together, to think differently. They don't want to work with the ordinary companies they have procured earlier, because they are not innovative. So we are creating that environment around this elderly care center in Karlstad, doing something totally new. We know there are a lot of services out there, and we want to put them together, working together, and create new services together with the employees in the elderly care center. And we're also building 2 municipality test centers, reality test beds in Värmland. We are now working on that project, and that's a very, very exciting perspective of how we will work with this. And all the politicians in Värmland and all the higher employees in the region Värmland we have agreed about this reality test beds. That should be something we will work with together and included in the normal work and business.
Hi, Magnus, if you can just wrap up, that'd be great.
Yeah, okay, thank you. Yeah, and when it comes to innovative entrepreneurs, then we have DigitalWell Ventures. We decided in March, starting with innovation support. We have a result since start of March, and we have offered them innovation support really to make it easier to develop services in together with the public sector and the research. And we have helped 50 since March. We have helped 50 business entrepreneurs. 110 services have we delivered. We have 20 different organizations, and we have delivered services to these entrepreneurs for 1 million. And 2 of them are now pilots in our new accelerator program. And we have an innovation council from the public sector, from university, from the companies, and from other innovation systems actors in Värmland. So this is an example of services what we have developed from the Marmor stage model. And then you can see we're helping them with prototyping, legal analysis, test of services in the Nordic Men test, and so on. And now we have launched a dual location accelerator as the next step. So we will invite, sorry. We will invite all the entrepreneurs in the Nordic and Baltic states in an accelerator program in Sweden and Norway. So we're working together with Norway in this one. And the DigitalWell Ventures program, we have started a certain LTD, or what you say in there, and we are operating this accelerator from now on, and we have five companies in the pilot developing this accelerator. So in the future, we now want to implement DigitalWell Ventures. We will, together with Vinnova, develop a new kind of accelerator from a demand perspective. We will still continue to develop a health arena development. We are creating this policy lab together with Sun Service Research Center at the university. We have a part of Health Innovation of Sweden. It's the European Digital Innovation Hubs. We are working together with 6 other digital health innovation hubs in Sweden. And we also work very closely to Novo Health Tech, Oslo Met, and other organizations, the Greater Oslo region. And we focus very much at the moment on cybersecurity because that's a base for innovation. If we don't feel trust and courage, so then we can't have courage to innovate new services. So open your mind, take the first step, and join us on the journey. Together we can ensure well-being for all, because we can, we like, and we must. Thank you.
That's great. Thank you very much for that, Magnus. I mean, certainly the breadth of activity that's going on in your region is very, very impressive in this area. We have a number of questions that have been passed on to me that I've put into the chat. We're not going to pick them up now because we're running slightly behind time, and I'm keen to give George the floor, but we will pick them up in the question and answer session at the end. Yeah, we've had a couple of people who have thanked the presenters so far for a very interesting session, but they're just leaving, so they'll get the recording in due course. So thank you very much, Magnus. And now it's my pleasure really to move on to the final presentation before our question and answer and discussion session. My old boss, indeed, George Crooks, Professor George Crooks, who will introduce himself. Thanks very much, George.
Great, thanks very much, Donna, and thank you for the old piece in the introduction. Yeah, I'm George Crooks. I'm now the Chief Executive of the Digital Health and Care Innovation Centre in Scotland. And I'll explain a little bit more about what we do in a minute or two as I go through my presentation. But what I'd like to do for the next 15 minutes or so is to complement really what Magnus was saying when he was showcasing the work in Värmland and relate that into a Scottish context and give you a little bit of insight into the approach that we are taking here. Next slide, Nessa. So first, a little bit about Scotland's health and social care system. We have 14 geographical health boards. They are integrated healthcare organisations specifically set up to support the delivery of health and care services across Scotland, and they're regionally based across the country, ranging in size from Greater Glasgow and Clyde, the largest single healthcare delivery organisation anywhere in Europe, covering a population of over 1.1 million people, through to Orkney, Shetland and Western Isles with populations of under 20,000. So there's a significant difference in size. We also have 32 local authorities that in the past were individually responsible for delivering social care services, but since 2016, health and social care provision has been fully integrated by law, and we are still working through to this day how on a practical day-to-day operational basis we integrate health and social care delivery, which is overseen by 31 health and social care partnerships who are jointly responsible for commissioning services, community health care, primary care, some hospital services, including mental health services, and as well as that, a percentage of the acute hospital budget sits under the umbrella of the health and social care partnerships to promote the joining up of services between community health and secondary and tertiary specialist hospital-based services. As everyone I'm sure in the call knows, the NHS across the whole of the UK, including Scotland, is free at the point of delivery. It is wholly funded through taxation, and the challenges that we have are no different to anywhere else, in that year on year, the percentage of GDP being consumed by health and care services is growing inexorably. At present, the budget for healthcare provision is £15.2 billion. Social care budget's about £4 billion, and the NHS employs 140,000 staff. Social care, about 199,000 people work across all parts of social care. But just remember that in Scotland, with a population of 5.4 million, about 800,000 people are responsible for caring. So the vast majority of that activity is done by our own citizens. And that is going to be reflected in what I'm going to talk to you about when we look at innovation in digital health and care. So a little bit about our organisation. Now, this is where we're based in the University of Strathclyde campus in the city of Glasgow. Next slide, Nessa. And we are one of 7 national innovation centres established by Scottish Government, funded by Scottish Government, the Scottish Funding Council, who funds our higher education authorities, our universities and colleges, but also some of my sister innovation centres have significant funding coming in from Linda's organisation, Scottish Enterprise, and their equivalent in the Highlands and Islands in the north of Scotland. And the areas that our innovation centres cover are key areas that government identified as being fundamental to the growth and future-proofing of Scotland's economy. So in the healthcare field, there is digital health and care, which I lead. We have got Data Lab, which is looking at all aspects of data, including AI, advanced analytics. Census, that look at sensors, but in all contexts, both industrial and manufacturing, as well as in health and care. We have got personalised medicine as a specialist innovation centre, also based in Glasgow, and there are other parts of the economy. We're looking at biotechnologies. We've also got a centre looking at aquaculture and in new methods of construction. And we work together collaboratively. So clearly, there's a rationale for having innovation centres, and Magnus alluded to that in his presentation. We recognise that we need safe spaces to bring together public sector, industry, academia, the third and voluntary sectors, and our citizens to be able to innovate in that safe, supported environment so that we can develop new products and services that are fit for the next generation and generations to come. And within my innovation centre, our vision is to use digital tools and services to address the societal challenges being experienced by citizens across Scotland today, but by so doing, create economic advantage for Scotland and for the United Kingdom. And that is about supporting Scottish businesses to develop new products that we can use in Scotland, but they can then sell globally, and equally to create inward investment, to attract companies to come and work in Scotland, in our ecosystem, to carry out the research and development in a collaborative way. Next slide, Netta. It will come as no surprise to you that the priorities that we have are very similar to those that Magnus showcased earlier. Non-communicable diseases, cancer, cardiovascular disease, chronic respiratory disease, diabetes are all there. Mental health, the challenges and opportunities through healthy aging is also important to us. And more recently, over the last year, the management of the challenges brought about by the global pandemic, but equally importantly, looking to the future, how we remobilize our services in a post-COVID world, recognizing that there's not going to be such a thing as post-COVID, as coronavirus is going to be with us through our lifetime and that of our children and our children's children. And we need to understand what that means for us. But equally importantly here is the issue of digital skills and workforce development. And I'll come back to that in a minute. Next slide, Nessa. What we're using the innovation system across Scotland to do is to recognise that in the past, where we invested almost all of our time, effort and funding on treatment and post-event care, we need to refocus and reset the balance of care to focus more of our activity on prevention, detection, on anticipation, and on independent living. And digital technologies are ideal to help shift that balance. And that is what we primarily are promoting within the overall digital health and care ecosystem across Scotland. Next slide, Nessa. So how do we do it? Well, first of all, we need to get the facts. And Scottish Government, a number of years ago, commissioned an international research programme looking at how countries around the world were addressing their personal challenges using digital tools and services. And we brought that back to Scotland and we tartanised that, put it within the Scottish context. We spent some time working out what thinking digital actually meant. It's not simply creating PDF files and emailing them to each other. It is about how we use the opportunities brought about by digital tools and services to support transformational change. So digital is actually a support service, not a product by itself. And clearly for us, it's about involving the right people at the right time to effect meaningful transformational change. So user-centered design, user-centered services are what we are all about, just as you are in Sweden and in other parts of the world now. Next slide, please. So what I'm showing here is the DHI innovation process model, which we've developed over the last 7 years. But I'm wanting to show you this to showcase how in Scotland we are mobilising all our innovation services to work in a more integrated and joined up way. I've talked earlier about the commissioning of cutting-edge market research. No longer can we afford to reinvent the wheel, do everything for the first time here and not learn from others. So collaboration, as Linda, Donna, Anders and others have said, is really important and will be more important as we move forward. Global trend analysis is important. We work with Scottish Enterprise and Scotland Development International to find out what is happening in other parts of the world. Where is the market pull as opposed to the push that we can utilise to our advantage here in Scotland? And we do current and future state mappings to understand not simply how we are delivering services at the moment, but what does a real future state look like, so that any investment we make now is not only going to last 2 to 3 years and then be dismantled and forgotten, and we spend more money reinventing something from the bottom up, that we build firm foundations and we evolve from there, which is a much more cost and time efficient way of doing something. Co-design research activity is fundamental to what we're doing. And therefore, how we award academic grants to institutions, how we spend that money in a more coordinated and joined up way is going to be key to us addressing the key priorities set by government. And specialist project management supported by people who know what they're doing in the field of digital health and care is important. And within our national health organisations, National Services Scotland, they have a team of specialist project managers, which our health boards can call on to support them as they're deploying services into their business as usual clinical environments. And then equally importantly is the focus on iterative development and scaling. We are now no longer going to be the home of multiple pilots. We're looking at testing, developing, refining, but through that process, building a business case for regional and national adoption. And that process needs to be managed and it needs to be nurtured. And the way we're putting our ecosystem together is all about embedding and adopting, and then learning and sharing that learning. Next slide, Nessa. So that all sounds motherhood and apple pie, and indeed it is. And if you were to ask me honestly, well, have you got everything sorted? Of course not. We're on a journey, and that's why collaboration remains important. But the one thing we've learned is that it's never about technology. There are three aspects of innovation that need to be considered at the same time if you're really looking for successful adoption and scaling. First of all, of course, there's technical innovation, but equally important is service innovation and business innovation. What are the business models for the future? And our ecosystem addresses all three of those. Next slide, please, Nessa. So what we do is we bring people in to environments, environments where they can learn together, environments where we can expose people to the art of the possible. That includes politicians, chief executives of health and care delivery organizations, others of influence. And it's only when you expose people in an immersive environment and they understand what is possible, can they actually then move their organizations at the same time as they move their understanding into the new world that we're going to be inhabiting together. Next slide, please. So our demonstration and simulation environment is designed to do that. It's a cloud-based infrastructure based on best practice around the world. And it allows companies to innovate in a low-cost, de-risked environment, connecting their products into some of our back-end databases and allowing them to see how their products would work. Initially simulation and using simulated data, then into a living lab function, and then into live deployments. Next slide, please, Nessa. So finally, I want to leave you with two thoughts. First of all, we need to understand the lived experience of our citizens. At the moment, you'll recognize the inner part of this pie chart. Our individual health and well-being is determined by a number of things. Only 20% of that is determined by the actions of our healthcare services. 30% by our own behavior, our diet, smoking, drinking, lack of exercise, and so on. 10% by housing, and the vast majority by our social and economic environment. What we did in Scotland is we mapped the data points that we can collect about our individual citizens very easily. And we found out, and I'm sure it's no different in Sweden or in any other country that's listening into this call, that in fact we're making life and death decisions about you, I, and our children based on the data that our healthcare system trusts. And the only data a healthcare system trusts is generally the data it generates itself. And that is about 16% of the available data. If we can start to blend citizen-generated data with formal health and care data and other government data sources, we can understand the lived experience. We can therefore make better health planning decisions, but equally importantly, health and care management decisions. And our environment allows that to happen, again, to demonstrate the art of the possible. Next slide, please. So what we're taking forward is this concept of Care 4.0. It takes the Industry 4.0 tool set. It doesn't simply deploy it in hospitals, which everybody's familiar with, where the hospital is a factory and we make our pathways more efficient. What it does, it basically says the person is at the center of everything. We must allow the person to be empowered to access services in their own terms and in the future be the point of data integration. And through personalization, recognizing that our health and care systems are complex and our solutions need to be flexible, we will develop digital tools and services in partnership that address those needs. So I'd just like to leave you with that thought, and thank you for listening.
Thank you very much for that, George. Okay, can I just ask our panelists, so Anders, Kenneth, Linda, Magnus, just to switch their videos back on? That'd be great, thank you. Okay, so just checking the chat now, just to have a look at some questions. I've added some in that were sent through to me, so I just want to scroll back a little just till we see where we're at. Linda, there was a question from Johanna from AER just asking about which stakeholders you find are maybe a little more difficult to engage. So I'm going to open that question actually to our panelists and maybe just concentrate on George and Magnus, if that's okay, in the context of your ecosystem. So which, just to kick off, perhaps George, you can start. Which stakeholders, if any, in the groups that you're working with in your ecosystem have you found perhaps more challenging to engage with, and how have you got round that so far?
It'll come as no surprise to you that if I said doctors, there'd probably be a significant agreement around here. The interesting thing about the world over the last year is that health and care professionals are now much more receptive to this agenda because of the challenges of coronavirus. And we've seen innovation adopted at a scale that is unprecedented. That being said, you need to make sure that you work hard to engage with all the key actors, and particularly the way that clinicians, doctors and nurses have been treated in the past has not been really positive. In other words, people have knocked on the door, said, here's a really shiny product, it's going to transform your life, but actually for you to adopt it, you need to change the way you're working. And as a doctor myself, the immediate answer is, no thanks, and I will use all my intellectual powers to undermine what you're trying to do. And that's why the innovation process that both Magnus was alluding to and the structures that we are putting in place change that dialogue. It is now into, the question is, let me understand the environment you work in, both from a healthcare professional point of view and also from a patient and a citizen. Let's understand the environment you inhabit. Let's then work out what a service model would look like that improves things for everyone who's part of that service. And only at the end do we layer in the digital product that can actually help. We were looking at things from the wrong end of the telescope for far too long.
Great, thanks George. I'm glad that you clarified for the audience that you are actually a doctor, so that kind of allows you to raise them as being a little bit of a challenging group on occasion. Magnus, Anders, do you have a different perspective in terms of particular stakeholder groups that you found maybe slightly more challenging to engage with in your ecosystems?
Well, I agree to George, really, but the problem is that the management of the healthcare system often are doctors. So even from a management perspective, it's hard to understand and to change and to find it interesting to collaborate with others, because my experience is we can do it by ourselves. So that's a big challenge, I think. But we have made really good progress in Värmland, I would say. But that's the hard core problem.
And indeed, I suppose the stakeholders, the various stakeholders in the ecosystem, all have slightly different drivers. You know, that it's the driver for them to engage are different, and it's about understanding that, isn't it? And yeah, delivering on that.
It's also, sorry Donna, but it's also about time. Because we have different time perspectives. Researchers, they think, okay, what's going to happen in 3 years? And the public sector and doctors say, okay, it's not so very hurry, so maybe next year. And then you have the companies and business companies really, now we want to do something that happens now and not tomorrow. So that's a complexity.
Great, thanks, Magnus. Okay, we've had a couple of questions just concerning actually the last part of your presentation, George, on data. Well, one comment actually from Sarah English from Scotland Europa just about data, but our colleague Anna Carazio from the Andalusian Health Ministry has raised a question around the survey on data sources and asking if you could potentially expand on that a little.
Yeah, sure. I mean, what we've determined is that as I was saying to you, that we need to understand the lived experience of patients. So I was presenting at an international pharmaceutical conference yesterday, and as we continue to develop medicines, it's becoming increasingly important that medicines need to be more personalized. We know that within the field of cancer, but actually across the piece. What we don't know at the moment is what are the citizen-generated data points that make the greatest difference. Where are the low-hanging fruit? So, for example, an area we do know something about, falls prevention. We know that if we can anticipate someone who's deteriorating, becoming frail, we can intervene early and prevent falls. We know the markers of that are sleep, exercise, and the provision of a set of smart scales so as you can assess hydration state. With those three things, we have been able to reduce falls in a care home setting, in a sheltered housing complex in the south of Scotland. The housing provider had 4 sites. They have 60 non-injured falls on average each quarter in each of those sites. In the one site, we deployed this digital service using simply things like a Fitbit and a set of smart scales. We cut falls, non-injured falls, to 0. Nothing to do with the technology at all. It's all to do with the fact that we were able to determine when someone was beginning to deteriorate and were able to intervene early. So that's an example. But if you can blend, for example, data from smart meters to find out how people are using electricity in their homes, if you can collect data from store cards, for example, loyalty cards, all with the consent of the citizen, you can then start to balance services. And I've got one very short story I want to share with you. I had a patient who was very, very unwell, wanted to stay at home, was receiving all sorts of services, including meals were brought in for her at lunchtimes. And she hardly ate any of them, because most of the food that she was given was stuff that she didn't like and she didn't eat, including fish and fruit and so on. No one ever asked her what she liked or what she didn't like. If we knew that she had never bought fish for the past 25 years, we could actually make sure that the service we provided her gave her things that she used on a regular basis and was familiar with. Simple things can be delivered with a little bit of thought. We often don't think, and we usually don't think from the user's perspective.
Great, thanks, George. Any final comments from Magnus and Anders on that point around the use of data? And
I agree to George. So no further comments.
Great. Okay. Well, we're just coming to the end of the session. I can't see any new questions in there, but I just wondered from the panel's perspective, do any of you have questions for each other, indeed, in listening to your presentation? So I'm just going to actually start with Linda. Actually, was there anything particularly today that you heard that you thought, I'm going to follow up on that? That was interesting for me.
I think there was a lot in there for me to learn. As I said, being a generalist and not a specialist in this area, I think the thing I will take away from that is around how we learn across sectors. So while I'm not operating in a space around digital health, I am doing some work at the moment in Scottish Enterprise on data and data strategy, much more broadly. And I think there was lots that people spoke about today that I'll be able to apply in essentially in a different sector. So I will be following up on some of that later on.
Great, thank you, Linda. Similarly, Anders, any thoughts about today's session and what you might want to follow up on?
Yeah, absolutely. I think this was very interesting and useful seminar for us. And one reflection from my side, we are both members of the Vanguard Initiative, which is very much heavy industry directed. We should need a Vanguard Initiative for this area as well in Europe. And we realize in Värmland we are a very small player in this field, and we have a lot to learn from you in Scotland, and we really admire what you do, both on policy level, but also that you are quite practical in what you do.
Thank you, Anders. I think that's certainly something that our colleagues in Scotland Europa have been trying to encourage us to think about for some time. So perhaps this will be the catalyst for actually moving that on with you. So we will definitely take that up. Kenneth, any final thoughts from you before we wrap up?
No, I'm very pleased of this webinar. I had high expectation and I got what I wanted. And I also got actually an answer to my question about the GERFEC, because I could see that the person-centered perspective is taken care of from the GERFEC success also in other areas.
We can follow up on that with you, Kenneth. So just to wrap up, I'd just like to thank all of our presenters this morning. Thank you so much for taking the time to share your experience and insight from Region Värmland and Scotland. And we look very much forward to further sessions, and indeed if anyone in the audience does have any ideas about what they'd particularly like to focus on, we would very much welcome those, as well as offers from AER regions to participate and present in a similar webinar. So without any further ado, I'd just like, on behalf of AER and the Digital Health Network, to thank all of you for your time this morning and to wish you a very good day. Take care, everyone. Bye-bye.
Thank you so much.
Bye.